Hi, this is Sharon Paulia. Today we're going to continue on with our course, Electronic Medical Record, and continuing with Module 6, Documentation on an OpenEMR, Part 2. I hope you all completed Part 1, so we can now continue on to Part 2. The next few screens are just a review of what we discussed in Module 5, which again is what we are going to document on. As I mentioned, we're going to document on medical issues, medications, immunizations, vital signs such as blood pressure, temperature, pulse, etc. I will continue on. Continuing on, what we're going to document on are medical history, surgical history, and family history, review of symptoms, SOAP, subjective objective assessment plans, patient notes, and referrals. We will get into each of these a little more in this module. So to start with, on how to document, first we need to choose a patient. Once we choose the patient, we want to open an encounter for that patient. That is, we want to open the visit. As I mentioned, a medical record is all the visits together. Today's visit is called an encounter. So we're going to open, click on the patient, click on the new encounter form, and enter all the information. A brief description of why they're here, whether it's a new patient or an established patient, and the issues they're coming in for, the problem. We want to document on allergies, medications, previous surgeries, as well as dental history. So once again, from the main screen, this time, once we open the encounter, we're going to click on the top left where it says History. Under that, we will be documenting actually on the patient's history. We want to capture several things, but I just want to point out on the screen that we can document on history, reports, documents, transactions, and issues. So again, we're going to use the tabs across the top of the screen, and now we're going to be documenting on the patient history and lifestyle. So the first tab is general information, and here we're going to just document, it's point and click. There's a spot on the right side if we want to add notes about risk factors and exams taken on patient. Other sections of the patient history screens are we not only capture information on the patient, we like to capture family history. So as you see, the second tab after general information had to do with family history and relatives. Now I want to discuss patient's lifestyle. This is important. It's just a way to capture the whole picture of the patient. We want to know their tobacco use, their coffee use, their alcohol use, whether they exercise, all the fields you see listed on the screen. And we like to know if it's current, or if they quit, or if they never did it, and if they quit, when they quit. Tobacco use, I just also want to point out, is very important, as I mentioned, for attesting and meaningful use, to get that meaningful use money. It's one of the fields that is captured is tobacco use, whether the patient is a smoker, was a smoker, and if they plan on quitting or if they did quit. The next tab we're going to discuss is the review of symptoms. This is basically an assessment of the patient. It's broken down into many fields. The ones showing on the screen today are just whether the patient had any changes, any weight changes, night sweats, anything to do with their eyes, their ears, their nose, their mouth, any situation that the patient is reporting or symptomatic of why they're here and why they're visiting you. And it basically goes through most parts of the body and most of the systems within the body. Once again, this is the patient encounter form. When a patient comes in, we create a visit, again establishing whether it's a new patient or a repeat patient. We want to document the reason for the visit, and any issues the patient has reported for that visit. So this is actually the beginning of where the patient encounter form is. On the left side of the screen, you would free text in a brief description. In the middle of the screen, again, it's the whether the patient's new or established and today's date. And on the right side, again, we're capturing the allergies, injuries, and medical issues. So for each new encounter, there's certain information we like to collect. Okay, so as you see on the bottom of the screen, we clicked on the clinical information, and here's where we can collect data on review of systems, on the SOAP, on the vital signs. Again, each time you click on one of these, a new screen will open, and I'll demonstrate this with the vital signs now. As I just mentioned, I'm going to show you how we're going to document and what we document on the vital sign screen. We like to collect height and weight. We enter this in height, we enter in pounds. Weight, you can enter in, height we enter in feet and inches. Weight we enter in pounds, which is then calculated over to kilograms. We also come up with a BMI, which is calculated from the height and weight. We also like to enter the blood pressure, the systolic and diastolic, as well as the pulse, respiration, and temperature. Again, it could be entered in Fahrenheit or Celsius, and it's converted, as well as the location of where we take the temperature. If it's a baby, we also collect head circumference, waist circumference. This is all done in the vital signs screen. And again, continuing on with our documentation, we need to document on the issues. We need to document on the problems. What problems are the patient reporting? This is called the problem list. Additionally, across the top, you can see the fields. We would then click on allergies. What allergies the patient may have, any sensitivities, their reactions. We also like to collect on current medications. Again, across the top, you see problem list, allergies, medications, surgery. We need, it's important to see the whole picture of the patient, what previous surgeries the patient may have had, and any dental information as that becomes applicable. And again, the SOAP note, as opposed to some of the other screens we looked at where it's very point and click, here it's more free text. So the physician would type in, subjective information, objective information, an assessment of the patient, as well as the plan to move forward. This is all then put into a note. Another important part of a physician visit is when a physician needs to create a referral to another physician. Maybe you went to visit your primary care physician, but as I mentioned, your knee hurts and you need to see an orthopedist. So on the encounter screen on the top, we would click on transactions, right where it says history, report, documents. The fourth one is transactions. This would cause another screen to pop open, and we would edit the patient transaction. In this scenario, the transaction type is a referral. So we want to collect the information. Who are we referring to? In this case, the orthopedist. Who is it referred by? That would be the primary physician making the referral. The reason for the referral, and any vital signs which may help the referring physician when he receives this referral. The more information, as always, the better. And lastly, once we create the referral, we would like to print the referral. In some EMRs, you can actually send it over via the communication section. In this case, I just want to show you how we would print the referral and what it would look like. So once we created the referral and the information's in there, we would print the referral, and it would come out on a nice referral form of, with the patient's name and demographic information and any diagnosis, and the doctor making the referral and why. and we would also include the vitals in this referral form as well. Thank you for joining me in this module, and we will continue on to the next module soon.